This portion of Lifestyles is sponsored by Evansville Hearing Aid Center.
Our tri-state professional and hearing expert, Amanda Bennett, is back with some good advice about treating hearing loss early. Good morning, dear.
Hello, how are you doing this morning?
I am great, and I am interested in you sharing your insights because I know personally people tend to wait a little too long to have their hearing loss tested.
Yes, they do. Actually, we know that people usually wait 7 to 10 years after seeing their first signs of hearing loss because we can compensate for it easily as far as asking people to repeat themselves and turning the volume up on your TV, on your phone, things like that, on your radio. So it's easy to compensate for. But what's not good about that is what we don't understand sometimes is we hear with our brains, not with our ears. So what happens is if you don't use that part of your brain, you lose it completely. That is something that hearing aids can't bring back. So that's why treating early is critical, because we want to retain that, what you have. So if it's gone, we can't get it back with hearing aids. But if it's still there, then you can hear. But some people think we're going to give them supersonic hearing with hearing aids. That's not the case. We want to get back what you have left. And we want to retain what you have left because it will progress much slower if you're aiding now. So the earlier the treatment, the better by far.
Well, you mentioned a few signs that people experience, like turning up the television and asking people to repeat themselves. So, Amanda, could all of that be avoided if we had a yearly hearing checkup?
Absolutely. We definitely recommend you have a yearly checkup, just like you have a yearly physical, so we can catch that in early stages. So the earlier we catch it, the better. And the earlier the treatment, like I said, the less you're going to decline, and the less frequent you're going to decline as well.
So do you see, is there kind of an age where people begin to have hearing loss, or is it just all over the map?
It's all over the map. I mean, we definitely see children with hearing loss, but with age-related noise-induced hearing loss, we recommend around 50 years old you start getting an annual exam. But we also, encourage anybody who feels like they're struggling or having some kind of problem to get a test just so we have a baseline so we can keep an eye on that. But definitely 50 or over, if you have never had a hearing test, then come on in and we'll get you scheduled for that baseline test. And of course, we will tell you if you have no hearing loss, and then we can keep an eye on you yearly. We'll send a letter out and we'll test you yearly just to make sure everything's staying where it should be.
Now, Amanda, we've talked about this before, but I think it bears repeating. I know people have this kind of idea that if it's just really loss in one ear, they just need one hearing aid, but that's not what you say.
Right. If you have truly one hearing loss or one ear that just has a hearing loss, it's okay to treat one ear. But most of the time, people want to treat the worst ear.
Right.
If you have hearing loss in both ears, you definitely need to have 2 hearing aids in. Our hearing system is designed to hear equally out of both sides. So our understanding is much, much better when we're hearing out of both sides equally. So if you have hearing loss in both ears, definitely need to be wearing 2 hearing aids. Now, if you have a dead ear and a hearing loss ear, then you can fit the, hearing loss ear. The dead ear can't hear anything. So there's other systems that we can use to treat that. But yes, hearing loss in both ears need to be treated both ears, for sure.
Amanda Bennett, thank you very much for your expert advice.
Thank you.
We'll talk to you soon. And we'll be back with more local lifestyles right after this. Stay with us.
This portion of Lifestyles is sponsored by Evansville Hearing Aid Center.